Honestly, the brain is so damn important. And I feel like most of the times we either overlook it in some ways, meaning we pay attention to our bodies. We go to the gym to work out our muscles all the time, and our brain really doesn't really matter that much as far as working it out. Or we just normalize this sense of brain fog, fatigue, missing words, anxiety, depression. Um, and it's a real shame. And I like to start off always hearing the story of kind of how you got into what you do and how you're impacted by brain issues in the past. And now you're looking to optimize your brain and your clients' brains and everyone's brain. So can you give us a little bit of like kind of what you went through with your struggles and what led you to today?
For sure, for sure. So really going back to high school or even before that, really as long as I can remember, I always dealt with a lot of like social anxiety, awkwardness around people. Talking to another guy in my class was difficult, let alone the cute girl, who I wanted to talk to. So I always just, I excelled academically. School was always easy for me in a sense, but like I would be nervous for having to talk to other people in the class when I had the class versus taking the actual tests. I knew I was going to do well on that, but like actually interacting with people was what my challenge was. So because of those issues, it was like always something that I was trying to, work on understanding and solving. So I think naturally that led me to, start reading the Bulletproof blog. This was back, I think like my junior year of high school. David started writing it, I think maybe somewhere 2013, 2014. And this whole idea that, we could actually modify how our brain and body functions with the food that we put into it, with the supplements that we take, that was a really revolutionary idea, at least for me at the time. People were biohacking way before that. But for me, that was my introduction into that space, drinking the buttered coffee and, doing all that. So, I started noticing definitely, with implementing some of those different things that my brain, did actually change in the way I functioned, level of mental clarity and focus. I still was struggling a lot with the social anxiety. And I really got to a point, where in college, I had a mold exposure. I didn't know what at the time was going on, but I got really sick my freshman year. I started having several nosebleeds a day. My hair was falling out. I couldn't focus or concentrate in any of my classes. And I actually started having panic attacks that were really bad. So that all led me to having to actually like withdraw from college for a couple terms. And I really did a deep dive into, what was going on, really understanding. I think like once I moved out of the dorms and saw how I felt like 75% better after spending that whole year going to different doctors and trying to figure out what was, driving my symptoms, and then realizing that it was something environmental, really just ingrained in me the understanding that, so much of how our brain functions and how we operate is the result of all of these biological processes that when they're going well, we just feel good. We feel happy. We don't really think about our brains too much. But when things go awry and you can't find the word that you're trying to say, you don't feel comfortable in social interaction, you start having panic attacks. That all kind of led me to really doing a deep dive on really understanding what was going on a neurological level that was kind of driving my symptoms to occur. So the mold was definitely a piece of it, but the social anxiety was something I always struggled with. That was there long before that. So really, reading some different pop psychology and neuroscience books led me to start working at a research lab in college, where we are actually doing EEG recordings and measuring, the brain waves, which to me was super fascinating, but we weren't really doing anything we weren't taking action on that data. We were just measuring people. We weren't actually doing any sort of intervention to improve and optimize people's brain waves. But at the time outside of the lab, I was getting into playing around with neurofeedback, a tool where you hook electrodes up to your head and record, and it actually gives feedback on how your brain is functioning on an electrophysiological level. So you can actually improve and rewire your brain. And doing the neurofeedback, I actually noticed great improvements in my own social anxiety, in my ability to just feel calm, present, talking with other people rather than that feeling of, that everyone was always judging me. I always got latched onto that obsession of how I was coming across to other people versus just being present and trying to learn and connect with another person. So for me, neurofeedback was a big tool that I found really made a big impact. I don't think it was the only thing. I think psychedelics, particularly MDMA, was another thing that really made a huge dent into my social anxiety. But, that's kind of like what I learned and then what I've started incorporating with clients, where I'm not just doing neurofeedback or just telling people to take nootropics. It's kind of a, holistic brain optimization program that I take people through, because I think all of these different things are tools, in our brain health toolkit. But when we stack these different things together, it really amplifies the results people get. So that's kind of a bit about my, introduction into this space, why I personally, cared and how, really as going through and seeing how it personally impacted me, I was also then starting to work with people in the fields of addiction and mental health and neurology, and seeing people both with similar issues as to what I was dealing with, along with very different issues, but all the same, we're really benefiting, going through their own transformations with this stuff. And I just thought, how is it that, traditional psychiatry doesn't utilize any of these tools? Say famous psychiatrist and neuroscientist, Dr. Daniel Amen, he talks about how psychiatry is the only medical profession that doesn't actually examine the organ in which they're treating. Mm. So I really latched onto that and figured okay, we can actually quantify what's going on in our brain. We can take action with the tools like neurofeedback or nutrition, nootropics, all these different tools to actually improve our brains. But no one in the mental health space is really talking about it. So that's kind of where I really saw the niche that I tried, I'm really trying to fill.
Yeah, it's always interesting how personal experience, especially with health issues, leads you to ask certain questions and also start to find the solutions. Because you yourself have to find those for your own sanity, health, all these things, longevity. And then you start to realize how sometimes flawed our systems are, especially in healthcare and others. I've seen that myself.